Our epidemiological investigations have identified that most of the cases in this cluster had visited multiple KTV clubs and outlets. And this was either multiple visits to several KTV outlets on the same day or multiple days during the period of concern. Some of the individuals who visited multiple KTV outlets, particularly on the same day, were visitor pass holders, and we cannot exclude the possibility that many of them, as mentioned before, were social hostesses. They come from a variety of nationalities that include Vietnam, Thailand, Laos, the Philippines, and others have worked as staff within these KTV establishments in a variety of roles. A second group of cases arose mainly in Singapore residents who are patrons and frequented these KTV outlets on a very regular basis. And it's likely that there's been considerable mask-off, close contact interactions which has taken place within these premises, which has allowed infection then to spread. And finally, we have detected infections among some household members, which suggests that some household transmission has already taken place. Of the 88 cases, 20 were asymptomatic and remain well in isolation. And the remaining 68 cases in that first 88 numbers had mild symptoms ranging from fever, cough, running nose, sore throat, some loss of smell and taste, and generalized tiredness with body aches. And at this time, the cases continue to have mild symptoms. None of them require oxygen supplementation or ICU care. The majority of these cases are young, which may have accounted for the fact that they were either asymptomatic or have mild infection. The age range of cases of the Singaporeans ranges from 19 years to 60 years old. And they are frequent patrons of these KTV clubs. However, as many of the more severe symptoms for COVID-19 infection only manifest in the second week of infection, we will need to continue to keep a close watch on all of them while they remain in isolation. Many of these cases are cared for in community care facilities where we have medical personnel, which includes doctors and nurses, to monitor their progress. And we admit those with a higher risk of severe infection into our acute hospitals where they can be monitored more carefully and can receive further care if their condition worsens. And this has been our strategy over the past 1.5 years to ensure that our hospital capacity is reserved for those who need it most. The present volume of cases that we have in our hospitals is manageable, and we have not exceeded our capacity in the hospitals or in the community care facilities. However, we remain on our guard for possible secondary transmission that can take place within this cluster through those who have patronized these clubs or had close contact with infected cases. And there is a risk, a possibility, that spread may occur to more vulnerable segments of our society, particularly the elderly who are as yet not vaccinated. And if this happens in a very big way, we may see more cases not only arising in the community as a result of infection spread from the cluster, but also lead to more admissions, and this may place our hospitals then under pressure. And this is something that we in MOH are watching very closely. Of the 88 cases, 82 of the cases were either unvaccinated or partially vaccinated. So in other words, they have not yet received immune protection from vaccination. And only 6 of the cases had been fully vaccinated. I'll hand the time back to Minister Ong to continue explaining about our response to this cluster.
Thank you, DMS. What DMS mentioned just now about hospital capacity, that's a key consideration when we decide on our safe management measures posture, which Minister Gan mentioned. We are taking a calibrated approach. We are not rewinding in a big way. But what we really need to watch and what will decide our posture will be our ICU capacity. Today, COVID-related ICU occupant is 1. We have 1 person in ICU, elderly. Our ICU capacity that is available for COVID-19 patients is about 1,000 beds. So this is what we have to watch closely. At any point in time, if we see that the capacity is under pressure, we will need to tighten up, hammer the transmission, go back to phase 2 heightened alert, for example, in order to preserve the capacity and preserve the proper functioning of our hospital. It's not unthinkable. In other countries, you notice the cases and ICU occupancy doubles every week. So if next few days, if more people fall sick, and ICU say is 25 people, in 1 week, it will be 50, 1 more week, 100, 1 more week, 200, 1 more week, about 500, 5th week, 1,000, system collapse. 5 weeks is what it takes. We cannot wait 5 weeks. By 3rd week, if we see the number go up, action has to be taken quickly and rewind us back to at least phase 2 heightened alert. So what to watch out for in the coming days, if we want to have a sense of our safe distancing or safe management posture. Infection numbers, everybody watch. Chances are next few days it will go up. But I suggest this, at this stage of the pandemic, with vaccination going on, it might not be the most important number. Because if the infected people, as DMS said, are young, they are vaccinated, their symptoms are likely to be mild, or they may not have symptoms at all, and they will not place a lot of pressure on the healthcare system. So instead, let's watch out on the number hospitalized with severe illness, needing oxygen or in ICU. That is the key number to watch in the next few days. If the numbers start to rise in a steep way, and that is bad news, it means we may have to consider significantly roll back the safe management measures. As to what will cause ICU numbers to go up and people to fall very sick, I think depends on 2 factors based on our experience. One is your age, the age of those infected, and second, are they vaccinated? So the problem we have today is that we have 140,000 unvaccinated seniors above 70, and so they are the most vulnerable. It is quite unlike, say, last year when we had a lot of cases in the foreign worker dorm. We could shield the dorm away from our community. And the dorm workers, they are young, they didn't put pressure on our healthcare system very much. And we could shield them away from our seniors, and seniors stayed healthy. ICU beds was not overflowing, and we could contain the situation. But today, the worry is we don't know who are the patrons. We try to identify as many of them as possible. If they visited KTV lounge, if they go home, interacted with parents, grandparents, and the parents, grandparents are not vaccinated, they can be in grave danger. So that is what we most worry about. There are 2 ways we protect them, this group. One is general population vaccination, and 2 is getting themselves vaccinated. If the general population is well vaccinated, then it's harder for the virus to reach them because there is protection against infection by if you are vaccinated. So fortunately, our population is now much better vaccinated than weeks before, and it will help protect those who are not vaccinated. So let me give an update here. As of 15 July, total doses is now more than 6.5 million under our national vaccination program. Those with at least 1 dose is about 4 million, so we have reached about 73% of our population. Those with 2 doses, about 2.5 million, that is about 45% of our population. We now report these figures every day in our press release. And on average, we are vaccinating more than 66,000 individuals per day. And if we just look at our current bookings in our system, sometime next week, we would have 50% of our population receive 2 doses. So this is ahead of the schedule that I talked about in the last press conference. So by sometime next week, 50%. And we are well on track by National Day to have 2/3, or at least 2/3 of our population having received 2 doses of the vaccines. And we are getting very encouraging sign-ups, especially over the past couple of weeks. Across all age group, percentage vaccinated or already secure a booking is 80% or beyond, except the group that need it the most. Those are 70 and above, only 71% have either been vaccinated or have booked. So this 29% of this senior group, or 140,000 of them, needs to be vaccinated. So that is what we are going to focus on in the coming weeks. We are doing several things at the same time. First, as reported in the media, 2 days ago, we sent out a letter, or DMS sent out a letter to all our GPs and all our primary care providers to urge them, call up all your clients who are above 70. Ask them if they have been vaccinated. If not, quickly get vaccinated. Our volunteers from Agency for Integrated Care, the Silver Generation Office, and the People's Association, they continue to reach out to the seniors, knocking on our doors, visiting them at home, addressing their concerns, sharing with them the benefits of vaccination. And when the senior gets convinced, the volunteers also help make arrangements to escort them, if they have mobility issues, to the vaccination centers. And so far, 100 of such escorts have taken place. As of end of June, the Senior Silver Generation Office have reached out to over 650,000 seniors nationwide. We are also sending out our mobile vaccination units to reach out to as many seniors as we can, deploying them in the community to be close to them. So there are 10 teams altogether, rotating around towns with a high number of seniors unvaccinated. So they'll be around towns like Kallang, Ang Mo Kio, Bukit Merah, Woodlands, Bedok, Aokang, Sengkang, Yishun, Tampines. So in the coming weeks, we are going all out to try to reach out to this group of seniors in order to protect them. So I hope out there, anyone who know any seniors unvaccinated, please help us persuade them. The benefits far, far outweigh the costs